The London Ambulance Service have 6 mental health joint response unit cars and they are staffed by a paramedic and a mental health nurse. They operate from 11 till 11, 7 days a week.
We cover all parts of London and can go to any kind of mental health crisis, ranging from social stressors and life difficulties up to chronic mental illness.
So as a paramedic working in mental health care for the mental health joint response unit, we go out with a mental health nurse and we bring the co-assessment model that the A&Es use of assessing the patient's physical and mental health needs to the patient's home in a crisis.
We've been running the mental health joint response unit for almost about a year and a half now, which means that both their physical and mental health are fully assessed at the time, and depending on what the greater need is or if there's any risk, then we can provide interventions between us.
In the past, when we've been treating mental health patients in crisis without the input of specialist mental health nurses and support from the mental health teams, it's been more difficult to get the right outcome for them. They've often ended up being taken to A&E because we felt we had no other option, and we generally know that that's not always the right thing to do.
I would say there isn't a typical day. Every day is different, so we get a range of calls. Sometimes the call isn't what came down, what you thought it would be. Sometimes they turn out to be medical. And we often don't get a great deal of information, so you never know what you're turning up to, which can be quite exciting.
Historically, the LAS has always sent ambulance crews, paramedics to patients suffering a mental health crisis, but in terms of the amount of training and exposure they've got, it's not always been as good as it could be. One of the benefits of the mental health joint response unit is it gives paramedics exposure to people in crisis, and it also leads to opportunities to develop more training to train the wider LAS staff as well. It's about bringing the right care to the patient at the right time and referring them to the right pathway, which is made a lot easier with the specialist knowledge and experience and skills of the mental health nurses.